All right. So I'd like to start with this line that research is to see what everybody else has seen and to think what nobody else has thought. I'm sure by the 8 sessions in today, the 9th session, all of us have gotten an idea on what research is, how to frame a title, and how basically you should try and get an idea to proceed if the idea is all right, and how you should present it. So what we are going to discuss today is writing a proposal, which is the fundamental beginning. Prior to any project that you can start, you should be starting with a proposal writing. So what exactly is a research protocol? So it is a well-organized, completely written document that specifies research plan and provides a framework of instructions or procedures to be implemented in a systematic manner for the conduct of research. What this means is we'll basically summarize what our plan is, what we plan to do, how we plan to enroll our patient population, what exactly, if we're trying out an intervention or if we're testing out any presence or absence of any factors, and what exactly, what will we be getting from those patients, how will we see those outcomes, how will we analyze it, and why is my topic important? Why should the scientific community think that this is a good topic, and what are the clinical implications basically? So why do you need a protocol? It's a roadmap for your project. So, like I said, you start from the beginning. You start from your recruitment. You guide, you tell people that you'll be recruiting in such and such manner from this time to this time, and you'll be doing the following interventions, or you'll be assessing the following factors and doing the next steps. It's a vital part of a research project because it not only helps you form a plan, it helps others understand the entire procedure, and most importantly, to understand what you're doing is ethically correct or not. Because I'm not sure if you all have heard of the Tuskegee trial. It's a very famous trial which was conducted in patients suffering from syphilis in the US. So this trial has become very infamous, particularly because they wanted to study the natural history of syphilis. So the patients weren't given any form of treatment, and they were just observed. So this led to a lot of deaths, and it was like a turning point in the research world on how important ethics are. So as a researcher, you would have different plans, but from a third person's perspective, they need to know whether what you're doing is following proper ethical guidelines or not. So, and then it gives written evidence for the necessity and feasibility of a research study, whether it is actually possible. There are some studies which perhaps you could not do. Maybe it involves a 15 or 20 years follow-up time period, which people obviously do. For example, the Framingham Heart study, but it isn't necessary that that period of follow-up would be feasible for someone. And other needs include, it helps keep the researcher on track, especially if it's a long-term project. Then you could quickly look through your protocol, through your proposal, and understand what exactly were your plans, and if you're still on those plans or not. It serves as a framework as well. While writing the manuscript, amendments are a very important part of a proposal, of a protocol or a proposal, because if any of you have actually gone and submitted protocols or proposals to your IEC, that is the Institutional Ethics Committee, then you know that each and every amendment has to be detailed. A single change in your sample size as well needs to be informed to the ethical committee. So amendments are one of the most important parts of a proposal. Writing a protocol, it also allows the investigator to completely understand the research question, because as I'll be detailing later, one of the important steps involves review of literature. So when you do the review of literature, you actually understand whether is this question really needed? Is the scientific community still not having a proper answer to this question? Is my research actually going to bring something some new finding? So those kind of stuffs are important. The protocol can also be viewed as an agreement between the investigator and the scientific community, because it offers a third person perspective who will be scrutinizing your proposal to understand what steps you're doing, if it's correct or not. So, what are the components of a research proposal? So, these are the few main components. It involves the title, the objectives, introduction, methodology, implications, and references. Each and every heading of this is very important. These are independent headings which must be present in your proposal. And each component has a specific method of, a specific guideline of following, which will help you write your proposal. So let's go to the first one, how to select a title for your study. It is very important that prior to attempting to write a proposal, you have a mentor who can help you. Ideally, in your colleges, it could be anyone, your senior resident to your professors who have particular interest in the topic. For example, if you're doing on gestational diabetes mellitus, then it should ideally be a professor who has experience doing research in this field, who has interest in doing OBS research. And then you have to seek the mentor's guidance for selecting an appropriate topic. Since the mentor would have done a number of papers, would have acted as reviewers in different papers as well, they know whether a topic itself could be possible in your hospital or your setting, and whether it will generate a good research paper. A good title must be short, accurate, and concise. Like a random estimate that I follow is around 15 to 20 words. Your title should be around 15 to 20 words. And it must make the central objectives of the study very clear to the reviewer. For example, your research question should almost always, the title should almost always have the form of form of study. Like if it's an RCT, if it's a prospective cohort or a case control study. So you often find papers in the literature with a title and then a colon and a randomized control trial or an observational study. So those kind of things are important. And why is it important, you would say? It's because later on, I think the second or third session from now on, I'll be taking how do we conduct a search on PubMed. And few of these keywords we actually use for finding articles. So suppose I want to know how many trials are conducted on a topic. Then I just put trial. And that kind of gives me all the studies which have that specific word used in it. And if it's there in a title, then it'll be more, easier for someone to select your study. So that has citation implications for people to find your study as such. So that's important there. Then obviously the title is the one that people see first. So that will increase your visibility of your research. But is it always mandatory to have the study design? Not necessarily so. For example, if you would have seen narrative reviews, they have a very fancy title. They do not necessarily have a narrative review or a comprehensive narrative review in them. So it depends. But majorly for RCTs, for observational studies, for any form of primary research, systematic reviews, and meta-analysis, it is a must that your study design should be mentioned in your title. So Zainab, could you launch the first poll? So this is based on our previous sessions. I'm sure you must be knowing this by now. Zainab, can you enable me to see the answers?
Are you able to view them now?
Yeah, I'm able to see it. Thank you. So I see majority of the votes in PICO, and that's the correct option. It's PICO. For forming a research question, it's the criteria we use is PICO, that is patient, intervention, control, outcome, and time period. Finer and smart criterias, these are something which we'll be discussing henceforth. Finer helps you select the title, and smart is for objective. For research question in particular, it is PICO that is used. And till now, does anyone have any questions? Please feel free to unmute yourselves and ask. All right, then. So framing the research question, one of the criteria that we use is finer criteria, and this is mostly important for framing the title of the proposal. So finer stands for feasibility, interesting, novel, ethical, and relevant. So we'll be detailing each criteria of this to test whether the title is accurate for the study or not. So feasibility. Um, for example, if any of you would have submitted for STS, ICMR short-term studentship projects, you know that you have a specific time period to complete your research project in. So, for example, if you would work in your summer vacations, that's almost 2 months. You cannot try and go for a question which would involve follow-up period for 2 years or 3 years, or maybe 5 or 6 years, when you wouldn't be possibly there in the medical college to continue your research. So time is one of the most important factors, and that's like the factor in which many of your ideas would get invalidated because you physically would not be there to conduct the research. Resource is definitely important. For example, for ICMR STS, they will not, by experience, they will not accept studies with huge financial requirement. This year, they have given a grant of 60,000, and I think for third-year medical students, it was even lesser. So your research should come under their budget plans, and for getting additional funding from your college is a very difficult thing, especially if you are a principal investigator instead of your professors. For nature of research, non-interventional studies are obviously much preferred than interventional and trials, because trials would involve a lot of ethical considerations, and we wouldn't be particularly sure if that intervention is necessarily correct to do or not. So it will be involving a lot of scrutiny, and usually ICMR STS, they do not prefer interventional studies. So for example, a study on prevalence of a very rare disease in the population of India. That will be very difficult to perform, because you wouldn't get the sufficient patient population, especially if you're conducting in your hospital. If those kind of cases do not come to your hospital, then obviously it will be very difficult to get patients from them. Another would be genetic analysis on predisposition of allergy to formalin among pregnant females. This would be difficult as well, because genetic analysis, these involve whole genome sequencing, transcriptomic analysis, and these are very expensive, which I think the budget would be in lakhs. So ICMR STS will definitely not prefer these kind of studies. Another could be a study on patent ductus arteriosus device closure among preterm neonates instead of surgical PDA ligation. Again, this is basically studies in neonates, infants, and children. This requires a lot of scrutiny, especially in the ethical point of view, because these are minors. They won't be giving you consent. Consent comes from parents. They obviously would not be willing to test anything out in their children. So it's very difficult to get consent, and ethical approval is almost near to impossible, especially if it's someone who doesn't have much experience in interventional studies. Another would be studying the prevalence of GDM in the population of India. Can any of you tell me why wouldn't this be feasible? You can unmute yourself, Deepika. Yes.
So, in a time period which is as less as 2 months, studying the prevalence in such a large geographical area is a difficult task.
Definitely, definitely. GDM, maybe you could try in your hospital, but that again would be a very small time period, as you said. So if someone has only their summer vacation, that is 2 months, it will be nearly impossible. Another is impact of maternal anemia on perinatal outcomes in rural India. This could be possible to some extent, especially if you have a rural setting to your disposition. Say you have a nearby village with whom your college is in association with, especially if your family medicine CMFM department is involved with that village, it will be easier to get your patient. Then studying the association between lung cancer and OCP in the department, that will be really difficult. Would any of you like to explain why? You can put your your answers in the chat box or unmute yourselves. Yes, Dr. Deepika.
The follow-up period is long to assess the relation.
Definitely. OCP and lung cancer, that will take a long time for manifestations to develop, for the disease per se to develop. It involves a follow-up time period of almost 10 years, 5 to 10 years, or OCP among women who are in their 20s, 30s, and lung cancer would likely manifest after during their menopause. So that's 20 to 30 years. That won't be possible. Then studying this, yes, Ovia.
Hi, I had a question.
Yes.
So we are operating that all of these questions will be randomized control trials?
No, not necessarily. These can be cohort as well.
Okay. So as a retrospective study, would it not be possible to do these things?
Okay, so maybe if let's say we can talk about lung cancer and OCP. If if you have lung cancer, say you select women with lung cancer and you want to see if they had taken OCP, um, if they had taken OCP 20 or 30 years back. Yes, that's
Yeah.
possible. That would be possible if it there can be some form of recall bias if you're solely relying on taking interviews from patients, if they aren't able to recall perfectly if they've taken OCP as well. But yeah, that would be feasible.
Okay. Thank you.
You're welcome. Then there's studying the side effects of a new drug for GDM. New drug, this is one thing people would automatically reject, because on what basis would you be conducting your research? They do not only look at your research question, they look at your background, your experience in conducting research. And for new drugs, there's like a way of before you introduce them into the human population, you'll have to do first in vitro studies. I'm sorry, study on cell lines, and then conduct animal studies, then conduct some form of organoids, or organoids are basically like tissue replicates on which you'll be conducting intervening any drug and seeing the effects. And then and only then you can start a pilot study on a very small population that will be hardly 5 or 10 patients, and then you could proceed further to assess a larger population. So that firstly, that will be time taking. New drugs, that's a no go when you're trying to test it first in humans. So hypothesis, I'm sure you guys must have seen this slide a lot of times. A proposed or predicted explanation to a phenomena with insufficient evidence. We know the concepts of null hypothesis and alternate hypothesis. In our research, we try to disprove the try to disprove the null hypothesis and prove the alternate hypothesis. And just to refresh your knowledge, Zainab, if you can post the poll too. Okay. Zainab, can you display the answers to me? Yeah, I can see it. Um, yeah, I'm so happy. Almost all of you have chosen for null hypothesis. Yes, it will be null hypothesis. Not no association is a form of null hypothesis. In alternate hypothesis, we're trying to disprove the null hypothesis. That is, we reject it and we try to prove that there is an association between parity and GTM. So with that, let's start with the next section after our title, which is introduction. So introduction is important to provide the rationale behind the work, so reviewers may understand and appreciate the objectives. So basically, you're trying to introduce whatever like the importance of the disease condition that you're trying to study. It's for example, your first paragraph should ideally focus on the prevalence, it's the burden of the disease, the morbidity, and the mortality. Then your second paragraph that can focus on the review of literature. So you say you parse the past 10 years on what exactly has been done on this, what do we know, what are the findings from these studies, and ideally if the findings are contradicting each other, say one study shows an association, another doesn't show. So and then after that, your third paragraph should be the gap in research. So one example could be there is conflicting views on a certain association, or there is disagreement on a certain belief. So your research would add to the evidence to actually understand whether the association exists or not. So gaps in research. And then the last paragraph should be the aim of the objective, what the aim of the paper. So what exactly you want to achieve by doing this paper. So one important thing is that it should be substantiated with references. References are very important, and like it's not putting references is not only unethical, it would lead to high plagiarism, and people wouldn't able to understand from where exactly you've gotten your sources, because there would be, for example, a line which says GDM is prevalent among 50% of among 20% of the women reporting in India, for example. Then what exactly is the source of this? It's not something you know. There has to be any source, and these sources should not be any gray literature. Gray literature would mean newspaper articles, or yeah, basically newspaper clippings. Those are gray literature. Proper evidence should be based on what like on GBD studies, for example. GBD is global burden of disease. So they are like an organization which conducts research on, yeah, they can yeah, I'll repeat the paragraph voice again. So let me just complete this. Yeah, so GBD is basically a global burden of disease. They conduct research every 3 years, 3 to 4 years, on which they assess the prevalence of a particular disease, and the burden, the morbidity, mortality. If you're taking source from this kind of study, it's very impactful. So paragraph wise, I'll repeat again. So ideally, just like if you're keeping notes, just write it down somewhere. First paragraph should focus on your prevalence of the disease, epidemiology. So in your epidemiology, you will be detailing the prevalence, the morbidity, mortality of the disease. Why should we consider why should we consider doing a research in your particular diseased condition? That will be the first paragraph. Then the subsequent paragraphs, you can take 1 or 2 paragraphs for that, should be the review of literature. There, you will detail what exactly has been done on this, what are, by citing proper references. For example, your line could be a study by an author X et al. Stated that women with higher parity have a higher risk of GDM. So that could be a line. So on basis of that, you state multiple sources and what their findings from their study was. Ideally, you could also, people who conduct their dissertation thesis, they include a table as well in which they detail the findings from each study. So that table could be something like the study title, the population under consideration, the findings, the results in numbers, and the conclusion. So that table can also be included. Then your the penultimate paragraph should be the gaps in research. So is there any disagreement? Is something not known properly yet in the literature? Are no studies found on the specific topic you are considering? And the last paragraph should be your aims of the paper. So is that all right? And does anyone have any questions till now? All right, so let's move on to the next part. Rational. So that is again, why are you doing this study? Why is it important for us? So that's again a part of the introduction. Then finally, you go to the second part would be, after introduction comes objectives. So objective is very important to state because, and it should be understandable by the person reading your proposal, that what exactly are you trying to do in your study. So it is a clear, concise, declarative statement which provides direction to investigate the variables under study. So objectives can be primary objective and secondary objective. So primary objective is the major focus of your study, that it will form the major chunk of your results section, your analysis and your discussion. And secondary objective are subsets of the primary objective. For example, if you're investigating a drug per se, then your primary objective could be the efficacy of the drug. If it was able to achieve a certain outcome. And secondary objective, these can be, suppose, adverse effects associated associated with the drug. If there was any mortality, that could be another. So for objective, we follow the SMART criteria, which is specific, measurable, attainable, relevant, time-based. Specific, that is to the point. You do not need to stretch your objective. It is hardly one line which states what exactly you're trying to do in the study. Measurable. So for example, you're trying to quantify the prevalence. So you mentioned that I am to quantify the prevalence of, for example, GDM, to quantify the prevalence of GDM in a tertiary care hospital in Eastern India, for example. Then attainable. The objective should be attainable, obviously, and that again correlates with our finer criteria, if it was feasible and if it's attainable. So, for example, a 1 year based objective would not necessarily be attainable in some circumstances. Relevant. So relevancy would again, that will be again a subset of the final criteria as well. If it is relevant to us. For example, suppose we medical students, we are conducting a study and we are like doing it on our population, for example, to measure the anxiety. So it is relevant in our perspective because we are able to provide an answer to a question which isn't necessarily having a general consensus on that topic. Then time-based as well. If you're doing it like within, if the follow-up period is 1 year, if the follow-up period is 2 months, something like that. So an example of the primary and the secondary objective that I give. Primary could be the to assess the effect of drug on total serum cholesterol levels in pregnant women diagnosed with gestational hyperlipidemia, measuring from baseline up to 8 weeks of treatment. So again, that's the main objective. So when I write my results section, I'll be focusing particularly on the effect. For example, say the total cholesterol levels at week 1, if that's my follow-up period, cholesterol levels, then LDL levels, something like that. Then another And the secondary objective of the same study could be to determine any differences in the drug's effect on lipid profiles between pregnant women and with and without pre-existing conditions. So I could perform any association with uh, existing preeclampsia or diabetes. Another one could also be the side effects of the drugs. If what were the side effects specifically, any major, minor, severe side effects, any mortality associated with it. Another example of a primary objective could be to assess the prevalence of psychological stress and its impact on pregnancy outcomes among expectant mothers attending clinics. So that will again be my primary focus in my results. And then secondary objective could evaluate different modalities of stress, that is maybe coming from work, maybe from peers, from social support or financial concerns on the well-being of the mother. Then, so till now we've covered the title, the introduction, and the objective. Then we'll be moving to methodology. So methodology, an important part of methodology is that it is written in exactly this way. Like you'll have to have some or the other form of these specific headings in your proposal, like as a subheading of the methodology. So methods, it helps whoever is reading your proposal to critically evaluate the procedure to follow step by step. And one of the most important things of methodology, as like some of my professors have always stressed, is that it should be so detailed that someone else who's reading your paper is able to replicate the same thing. You specifically do not hide any facts or gloss over any facts. You state it in such a way that any external person who doesn't know you, who's just reading your proposal, is able to follow your research step by step on the basis of your methods written, and is able to arrive at a similar conclusion as yours. So first would be study design, or the type of study. So that will be simple. You will be describing if it's a cross-sectional study, case control, or RCT, for example. Then a study population of participants. I'm sorry. So that will be detailing on the if humans, or in case you're doing any animal studies in animals, or what cells you selected if it's an in vitro study. Then study duration. So if it's a 2 months period, then you write from, say, October 1st, 2024 to 15th October 2024, something like that. The study will be conducted across 2 weeks. Then sample size. So sample size calculation is a separate topic altogether. So for different study designs, there is a specific way of calculating your sample size, and there is a website that I can link to you all. You can just explore it. I won't be covering how to calculate sample size in this session, but you can look into it. I'll just mention that in the comments. Okay, so I've given a link in the messages. You can just go through this website. It has how to calculate the sample size. You just enter your data depending upon the study design, and you will be able to get an appropriate sample size which will satisfy the power of the study. After this, you state the inclusion and exclusion criteria. So one thing that people tend to do in their inclusion and exclusion criteria, which you can do at a primary level, but ideally as you do more and more research, it's something that should not be done. For example, your inclusion criteria could be people more than 18 years, for example, age criteria, and then you write in the exclusion criteria people less than 18 years. If you read research papers, you do find people writing this. But ideally, as you progress, as like you write more high impact papers, this should not be done. If you're stating patients greater than 18 years are included in your inclusion criteria, it is done. That you're obviously not including patients less than 18 years, unless until you have another part of greater than 18 years that you're not including. For example, you're including patients greater than 18 years, and in the exclusion, you're right, we're excluding patients who have diabetes, for example. So that can be a good, greater than 18 years, but who have diabetes. So within that subset of population that you're including, you're excluding people with diabetes. And then another could be your inclusion are females and your exclusion are males. It doesn't really make sense. It is understood that if your inclusion is females only, then your exclusion is males. People, and I'm stating it again, in when people begin out, they do write this, but ideally this should not be done. Then next is after this, you would detail your ethical considerations that your study will be conducted after taking approval from your, if you're doing in a tertiary care hospital, from your hospital's institutional ethical committee, clearance from institutional ethical committee, and you'll be following good clinical practices guidelines. Then going to data collection. So here you'll be detailing your data collection, the study tools, and the exact steps of your research. So, for example, if you're doing randomization, if it's an RCT, then you would detail how exactly you're doing randomization. Is it simple randomization? If it's block sampling, these are different forms of randomization of it. Or if it's computer generated sequence or envelope method, then you would detail, if it's an RCT again, how will blinding be done? For example, the drug was distributed in bottles in whom the labels were covered. So that is a form of blinding. If your study is open label, obviously both the participants and the investigators, they know what the intervention is. If it's double blinded, then both of them do not know. Then you would mention the setting of your study. That is, for example, if you're doing for example, the outpatient department of the obstetrics and gynecology department of Dash Institute, whatever it is, or a tertiary care institute. Then you will detail your study procedure. That is, how will you screen those patients? How will you assess? For example, if you're saying that you're excluding diabetes patients, then you will state obviously that a baseline or a fasting blood sugar was done of patients, or a randomized blood sugar was done, and levels greater than this value were excluded from our study. So you would detail every procedure like that. Then you will detail your variables, your outcome variables, like, for example, you're measuring HbA1c or LDL levels. How would you measure that? Like collecting blood at so-and-so time after fasting, or random blood sugar at any time. And then finally, the statistical analysis. Statistical analysis, you would summarize what variables you obtained, the statistical tests that will be used, the software that you will use, for example, Stata or SPSS, and the level of significance you're doing. So level of significance, it has been discussed in previous sessions. If ideally, almost all studies have P less than 0.05 as significant, and some may have P less than 0.01 as significant if their criteria of doing study is different. So one thing I would like to mention before I move on in statistical methods, do not some people I've seen, they just write a statement that is appropriate statistical tests will be used for analysis. That isn't correct. If one doesn't know how to do the statistical analysis, please consult your CMFM, or I think they call it PSM in other colleges, your PSM department, your JRs, junior residents, to help you understand the nitty-gritty of statistical analysis, what kind of software is being used, what kind of tests can be done, for example, chi-square tests or any t-tests, pair t-tests. So those are different kinds of statistical tests. And, if you detail it, as detailed you go, the preference of your protocol or your proposal being selected improves. Okay, so that's about methodology. This again is something which has been discussed time and again in our sessions on the evidence, on our evidence pyramid. So based on this pyramid, wherever your study design lies, you could choose that. So this is an example of the very broad methodology section of a study, which is assessing prevalence of hypertensive disorders in pregnant women. So this is, suppose, a cross-sectional study. Study population will be pregnant women. Sample size, suppose you calculated it and it comes as 80. And your inclusion criteria could be pregnant women attending prenatal clinics between 20 to 36 weeks. Exclusion criteria could be any chronic hypertension, preeclampsia, or any pre-existing chronic diseases, cardiac conditions, renal conditions. Then your the ethical clearance part, you will mention about IEC, your informed consent about patient information sheet, and then the procedures, what exactly would you do, like BP checkups or urine analysis. Then the next. So again, I would like to reiterate what were our headings till now. It was title, introduction, objective, the methodology. Now we're going to implications. Implications would state what is achieved by the study. Basically, again, detailing why is your study important? Why, suppose if you're giving it to a funding agency, then the funding agency will think, why is what benefit would your study bring to the greater population? So what is achieved by the study? So it can be substantive, that is, potentially a new policy could be developed, potentially a different management guideline could develop from your study. Or theoretical, a new understanding of the disease. For example, you're studying how exactly preeclampsia develops. Then a different perspective on its pathogenesis could be studied by like your study. Then methodological, or a new way of analyzing the study. Then referencing. Referencing, as I said, it's very important because at least one of our like you'd see in ICMR, especially for thesis submission, they ask for a plagiarism report. Your plagiarism should be ideally less than 10%. And plagiarism is basically how similar your some lines of your study are to previously published papers. If you directly copy paste a certain line, that will obviously lead to a high plagiarism. So one point is to paraphrase it, and second point would be to reference it. And referencing must be done using proper softwares. Some softwares you could use are Zotero, there's Mendeley, and there is there are automatic referencing softwares which aren't very standardized, but you could use them as well, like Scriber. So finally, once you write everything, how would you know it's a good protocol? It's able to answer the research question, it is feasible in that particular setup, and it is able to provide enough detail for another investigator to do the same study step by step, and is able to arrive at a similar conclusion. So common mistakes that people do when writing a proposal is that they include very little details about the study and insufficient justification. One justification that people almost always write is no study has been conducted in the Eastern Indian population, hence I'll be doing this study. This isn't really a good justification of doing a study. Your justification should be something like there isn't a good consensus, like there isn't agreement between different literature, or there is no evidence as such on a question in particular. Doing a study, like you could write it, but it'll lead to a lot of rejection. People do not really prefer seeing that a study wasn't conducted here, hence I'm doing it. Then another mistake that people do is they're doing far more work which can be reasonably done during the study period. If you're doing for 2 months and a study for 2 months and you're mentioning a follow-up period of 1 year, that isn't really possible. So every line should be properly read once you write your proposal, and it should be like you should make other people read your proposal so that they can help point out a few mistakes, few logical mistakes which you might not be able to identify when you're writing a proposal for the first time. So can you do a project without writing a protocol? You could, obviously you could, but you probably should not. This is because, as I said earlier, the protocol is basically providing you a gist of what you're going to do. It's like a cheat sheet. So you have everything ready. You know what you're going to do. And when you actually jump into the research proper, you can just refer to that cheat sheet, look into what details were done, and you can just do that in a broader scale. That, and second would be, since you're getting a third person's opinion, they will be able to tell you that something is wrong here. There isn't a proper explanation of such and so and so point. So you could modify that, and your research outcome gets more and more powerful when you're getting someone else's review. And hence you would find actually many people publishing their protocols itself in different journals, in big journals, so they can get an overview of other people, what they are thinking, and it kind of helps them better their research outcome. So that's it, guys. Thank you so much for your patient listening. And I'm sure you guys must have doubts. Please feel free to unmute yourselves and ask, or you could message. Yes, Avantika.
Hi, can you please repeat the referencing part?
Okay, referencing. So for referencing, one point should be when you're trying to, like you have a study, for example, which states any fact. And when you're trying to use that line in your paper, you should try to paraphrase it. Like read that whole paragraph, try and explain yourself the whole facts and write it in your own words. That will reduce plagiarism. That's one. Second would be when you're doing the referencing, you could ICMR, for example, they follow Vancouver style of formatting. So you have Zotero and Mendeley. I'll just write that down in the messages if anyone needs that. So these are softwares you can download, and these help in seamless integration of the references. That is citation, how you would write, like for example, in square brackets or giving number one as superscript, and below how you write your bibliography. There's a particular way of writing them down, and it's better, instead of doing it manually, you use these softwares. Did that answer your question, Avantika?
Yes, thank you.
Okay. You're welcome. And I think the post-event questionnaire has been shared as well. So please make sure to fill that out. Are there any more questions?